will get better. Wouldn't last forever.
7:30 coming around towards 7:31 in Trinidad and Tobago. Well, the country's COVID-19 cases continue to surge, with the Health Ministry reporting 120 new cases yesterday, including 5 new cases of the much-feared Brazilian variant, making it a total of 9 cases of the P1. The Supermarkets Association issued an advisory urging that customers reduce the number of shoppers to 1 person per family as a result of the rise in cases. The country has vaccinated over 41,000 persons thus far, including our next guest, Dr. Visham Bimal, who is no stranger to our different dialogues. He received his first dose on Sunday. Let's get his views on the third surge and the conversation surrounding the AstraZeneca vaccine. Dr. Bimal, good of you to join us once again.
And good morning to your viewers. Ramadan Mubarak to all your Muslim viewers.
Thank you very much indeed for your kind greetings in that regard. Any side effects, any discomfort after the first vaccine?
On the day of getting the vaccine, which was Sunday, no. Yesterday, I just had some pain and swelling, but that was essentially it thus far.
And no doubt, as a medical practitioner yourself and a professional, you will fully endorse citizens taking the vaccine.
Yes, I would. I mean, in a discussion we had earlier, the vaccine rates in Trinidad and Tobago has always been really good. Since I was a child, to go and get your vaccine or get it at school was something quite common. And I think the population of Trinidad and Tobago has stuck to that, irrespective of the international reports and the 2 deaths we had here in Trinidad.
Well, let's put it in the perspective in which you did in a letter that you submitted to the media, and it was in the Newsday yesterday. And I'll go with the last line. You say, and I quote you, "As this pandemic continues, we will have to continue striking a balance between the possible large morbidity and mortality of COVID-19 and how much economic decline we can withstand." Just elaborate on that, because that's a very difficult balance.
Yeah, I know. As I always say, this pandemic is nothing new. In the last 100 years, there has been 5 major pandemics that has scourged human civilization, and the fact that we had to compromise the economy for the sake of public health was also present there, so much so that they did lead to some economical decline. But at the end of it, remember, human beings, with regard to something like infection, when we had the influenza, if we had adopted, or whenever we have flu season, if we had adopted these measures of washing your hands, making before you enter, as well as after you sneeze or cough, that would actually reduce the spread. Because now we have a virus that has a greater morbidity and mortality than influenza, we had to, accentuate those practices. So apart from that, even measures of or ways to boost the economy that is not traditional, we have to even explore now.
And as far as exploring that, I suppose what compounds the problem would be the inequalities, the inequities, and again, you seem to be the the medical practitioner of choice, because there's a piece in the Express from last week Monday recognizing health inequity in Trinidad and Tobago. And if you tack on economic inequity, because for example, the very wealthy are better able to ride out this period because they have enough of a financial cushion, whereas the working poor, which means that you're working from salary to salary, you're living from salary to salary, you're in debt all the time because you're just paying bills and so on, you are extremely vulnerable. Then you add to that, because of those economic circumstances, you're not able to afford the best health care in some cases. You don't have the time to do all of the necessary tests and checks and so on. So you're in a health dilemma as well. It seems to be a very difficult situation to be in when we talk about that inequity.
Right, and that's nothing new. I go back to Sir Michael Marmot and the health gap, because that was groundbreaking research when you look at what you mentioned there was the social determinants of health. And the fact that we have a pandemic that has now brought that to the fore, even in the media. I mean, certain instances of social exclusion as racism with the recent Black Lives Matter was a typical example of that. It doesn't bring up inequities only in the health sector, but inequities in general, economically. And I want to go back to the vaccine. There's a lot of, whenever you talk about pharmaceutical industry, there's inequities there as well. Because if you look at all the vaccine makers, these would be high to middle income countries that could afford the research to get it done. The US, AstraZeneca, which is in England, Russia, China, and so on. So if you look at, remember we spoke about herd immunity.
Yes.
For herd immunity to happen, we should have vaccinated 70% of the population. But if we look at the distribution of that population among poor and rich countries, the richer countries has 20% of the total population of the world, and the poorer countries 80%. Now, the 20% we spoke about are producing the vaccine and have ordered the vaccines already, so that they have more than 50% of the vaccines available to them, whereas the poorer countries have less than 50%. So in that context, where we would want to vaccinate the majority of the world, which is the 80% poorer countries, we have to look at that availability. Remember, if we look at how we were supposed to deal with this, it is delay and vaccinate. And we've been doing that. We roll forward or we roll back lockdown, right? In phases based on, for instance, we have had a surge now, so we have rolled it forward. In that context, what we call flatten the curve, right? We don't want to overwhelm our healthcare capacity. In doing that, we are actually delaying to basically have a vaccine, which we have in 1 year. But that vaccine and the attempt was supposed to be a worldwide attempt where it was collaborative, so that we have a availability of a vaccine that was free. And we see that with AstraZeneca. We don't see it with the others. So again, that emphasizes the inequity, the availability and cost of the vaccine, and inaccessibility to less than 50% by poorer countries.
And therefore, Dr. Visham, is there any way out of this? Because people agree to things, they sign up to things, and then when it comes to crunch time, they see what they sell first and everybody else after. For small countries like ourselves, Trinidad and Tobago, CARICOM region, for example, is there any way that we could do things differently? Do we have the resources to have to do the research or whatever? What is your recommendation?
The thing is, I think Trinidad is a model CARICOM country with regard to, I mentioned our vaccine rates. They are relatively high. The fact that our citizens, I remember when I lined up on Sunday, I gave the vaccine as voluntarily as a doctor with the Trans-Tobago Medical Association, but it was completely packed. So people still want to get their vaccines, and it's been rolled out very well by our Ministry of Health. In looking at that context, I want to use AstraZeneca as an example. Now, what really was supposed to happen is that after these vaccines were produced, there was something called a patent. And a patent is whenever you have an invention, be it a medication, vaccine, or contraption, you have sole rights over it. Nobody could mass produce it in a cheap way, right? That way you recover the costs that went behind the research to produce it. Remember when we went to the collaborative initiative, it was supposed to be that tycoons like Bill Gates and international businessmen contributed, taxpayers contributed, so that we would have more than recovered the income from the research in producing a vaccine. So there's no need now to charge extra and put profit before people. We see it with AstraZeneca, because AstraZeneca, a British-based company, actually had waived the patent for India to mass produce it. And you know, India produces medicines effective medicines at a much cheaper rate, so much so that the Modi administration was able to give vaccines to poorer countries. I mean, there was the issue with Trinidad and Tobago and us not accessing that. But a lot of CARICOM countries had benefited from it. But that, even in AstraZeneca, that has continued, and AstraZeneca actually is one of the vaccines that has the wider reach and it has reached the poorer countries, but less so the US, Pfizer and Moderna.
You know, there are a number of different angles which we could continue this discussion, Dr. Visham. But one interesting point, and it was brought up in a discussion we were having with the business community last week, of the number of persons tested. For example, the latest update which we got yesterday, 128,000. And of that 128,000, 9,796 have returned positive tests. That's 7.62%. How does that place us? Because if we were to extrapolate that as to the overall population, that would suggest that a significant number of people are walking around with COVID-19. It's just that they haven't been tested. Is that a reasonable assumption?
Well, on both ends. One is that, remember, people who have had it and recovered will remain positive for a while. But those who are asymptomatic up to 21 days, yes, would test positive. That is highly likely. But again, it goes towards now our testing mechanism. In other words, is it efficient enough to pick up those cases? And remember, earlier in this pandemic last year, that was a concern of some, that the government itself was not doing sufficient testing. But apart from that, that's one end. The other end is that if we're not doing sufficient testing and the spread is happening quickly under our noses and we can't figure out what is going to happen, is when we look at the other end, eventually our health capacity will be overwhelmed, and then that would show up in the media.
Are you worried about the Brazilian variant?
Yes, I am, because the new and that this is also the end result of availability, because the longer the richer countries hoard vaccines and they do give it to the poorer countries by any initiative and patent wavering, the more time goes where the virus continues to spread, mutate, and cross borders. These new variants have more infectivity. In other words, that they jump from person to person faster than the original strain of the COVID-19. So yes, it is of major concern. One thing though that has alleviated my fears is that the research has shown that even these variants, the vaccine is effective against them. The only issue is now that we should pick them up faster, and we almost must remember, whenever the delay and the vaccine, when we delayed before we got the vaccine, basically we had widespread testing, quarantine those who had symptoms or those who were in contact with others, as well as physically distance. So that has seemed to work, at least in Trinidad, because when you look at international number of deaths due to COVID-19, Trinidad has done pretty well.
And as far as the vaccination program, as best as you understand it as well, again, we have a limited supply. We're hoping to get some more. We're hoping to get some from the surplus from the United States and so on. But again, with all the many variants, with the different mutations, with the expiry date, for example, of the vaccines and so on, and its effectiveness, is there enough data around to advise as to how long when you for example, when you get your second dose, how long that protection will last for? Will you have to have a booster shot? Will you have to have another one in 6 months' time by the end of the year? What do you see happening?
Yeah, I mean, again, the data on that is not out, right? Remember when COVID-19 had come, they had said, well, if you look at the earlier strain of it, which would have been SARS, CoV-1, if you got infected, you would be immune to it. Now there was evidence that shows that some people or it is not clear as to how long the antibodies against this particular virus would persist. Again, that data is out, and only time would tell with regard to that. But based, as I said, on previous pandemics and what we've done, I guess the human race is not doing anything differently. We are doing what we know worked in the past.
I hear you on that, Doc, but I suppose it's fair to say that this one, compared to the previous ones, SARS, swine flu, so on, so I mean, we were touched by it, but this is the first one for a long time that is truly global, that is impacting us to this level, and as a result, do you suspect that we are some distance away from winning this battle?
I would say yes, and I have said it in my press releases before. Because remember, only 1 year passed, and when we look at the previous ones, it went up to 3 and 4 years at times. So yes, we still have our work cut out for us, but we must look at the bigger picture. Why are we having these? Virulent pandemics coming over and over? It is because we have to, and the answer to it is, we have to explore how we utilize resources on the earth, because you would know that most of these viruses is because of animal husbandry and because of the need for meat in the commercial market. Once humans continue to interact with animals so closely, this is going to continue to happen. And if we think this is the worst of it, it will continue to get worse. So we have to re-explore how we utilize resources on planet Earth.
Dr. Visham Bimal, thank you very much indeed for taking the time to share your thoughts on an issue that is going to be with us for quite some time, and it's so important to us, for us to get the many different perspectives. Thanks once again.
Okay. Thanks for having me.
You're more than welcome. Dr. Visham Bimal, medical practitioner, there with us, offering his own views on the whys and the wherefores, and indeed the circumstances of pandemics like this one, and indeed how do we move forward from an experience like this, again, which will be with us for quite some time. As we go to the break, here's a submission from Mary De Silva of Faizabad, who admitted that she was sending her images to the wrong number for weeks and was glad that she finally got the number correctly to participate, and now it's that's the image of the cat in the fig tree. I was going to say banana tree, but I know it as a fig tree. What is that cat doing in the fig tree? Well, you like green fig? I don't know. But now for an image of the Jump Up and Kiss Me flowers from Cynthia from Pinal. Thank you very much for those very interesting images. We'll be right back.